Greg Snyder is an attending physician of general internal medicine in the Department of Medicine at Newton Wellesley Hospital, a hospital a part of the Mass General Brigham Health System. He is also an affiliate faculty member at Ariadne Labs, an entity that studies the implementation of best practices for healthcare delivery and works for innovative startups that are attempting to improve the quality and access to healthcare, including through telehealth. Can you tell us about your role as a general internal medicine doctor?
Certainly, yes. No, and thanks for phrasing it that way, because I think of myself as a general internist, though I practice hospital-based medicine. So I practice medicine for acutely ill adult inpatients who have to be in the hospital because of how sick they are. I've practiced primary care in the past and urgent care in the past. And I now practice virtual hospital care as well.
Oh, wow. And now the virtual hospital care, is that as a result of COVID? Or were you doing that prior?
No, not entirely. So I work, maybe I'll just mention sort of what I do professionally. I work clinically at Newton Wellesley Hospital as a hospitalist and teach as a professor at Tufts University School of Medicine. But I also work for a venture-backed company called Medically Home that helps health systems build virtual hospitals. And so we take patients either out of the emergency room or, out of the hospital itself or other settings and bring them back into the home and then provide them with the same level of care they would have gotten in the hospital. So I find myself treating those patients in the same way that I would have if they had been in the hospital.
Okay, that's really cool. I've never actually thought of something like that.
Yeah, no. To answer your question, I mean, we've been around for a long time, but COVID has certainly accelerated that model of care, and now a lot of health systems are building programs with us and separately, and we're very excited about it.
Yeah, no, there's a lot of great stuff going on. I mean, despite that we're living in this crazy pandemic, but no, it's amazing, and that sounds just so interesting. So I guess we'll start a little bit off with your injury. So can you tell us a little bit about what happened, what you have, quote unquote, and then we'll get into kind of the doctor-patient role, as now considering you can be, you understand what being a patient is, as somebody who has their own injury.
Yeah, no, so medically, I have paraplegia. I'm a T9 Asia A paraplegic. At least that's how it was classified when I was injured in 2013. I broke my back while hiking or climbing. I don't remember exactly which. I was at the end of my third year of medical school and took my dog for a walk. And I remember tying his leash up around a tree and waking up a week or two later in the intensive care unit at Jefferson, which is the medical school where I was a student at the time. And so I don't remember exactly what I was doing. I was probably walking along an abandoned quarry that was nearby. I might have been trying to climb, slipped and fell. I don't remember, but broke my back and was left paralyzed from the waist down. So no motor or sensory function from about the waist down. That hasn't changed over time. And, I think so that's the medical side of things. And I think of myself as someone who, sits in a chair rather than walks around, and that has certainly changed my perspective on things, and has obviously forced me to think about life in a certain way, medicine in a certain way. But I feel fortunate because I was very well supported during that time, which I know is not something that everyone can say. Both by the medical school where I was at Jefferson and then by my family and friends.
Right. No, of course. No.
I mean, I'm in a very similar situation in terms of just having like the support and access to care and all of that. And obviously my injury is the complete opposite of yours. But just in terms of, being able to overcome or, learn to compensate for our obstacles and so forth. Unfortunately not everyone has that. So and I think it's a kudos to you. You continued to go on to you continued your medical school journey. So after your injury happened, or your spinal cord injury, um, did you think for half a minute that maybe you weren't going to continue on with medical school, and how did you basically decide that you wanted to continue?
Yeah, no, I probably thought about it for a quarter of a minute.
Mhm.
No, I think that the reality is that after I had my injury, there wasn't a whole lot else that I thought about for a long time. And I think that in part was because, it really wasn't a point in time for me. It was a process. And the way I felt about myself, about my injury, about my future career, but really my future life in general, really changed a lot over the course, not obviously of falling and breaking my back, but then of being in the inpatient hospital, in the inpatient rehabilitation hospital, in the outpatient rehabilitation sort of physical therapy referral cycle, and really every year thereafter, I've considered it a process. But
Mhm.
to answer your question, there were certainly points in time where I considered different career paths or my ability to pursue the career path that I had set out on.
Mhm.
Um, but I think that was a very small percentage of the time. I think that I I broke my back at the end of my third year of medical school,
Right.
and I had done much of the training in medical school that I needed to do.
Mhm.
I had questions around my ability to do certain things as a trainee in residency, and potentially fellowship going forward. So working through those questions is, I think, what allowed me to remain confident that I would be able to practice medicine. Um, but to be very clear, I think actually the process was one of discovering that I was going to be a better doctor by being in a wheelchair,
Mhm.
not that I would be limited.
Right, absolutely. So, how does being a doctor and seeing your patients um, kind of give you a deeper understanding of, who you're caring for and what they're going through?
Yeah, no, I think if it's okay with you, I'll sort of flip the question around a little bit
Yeah.
and say that um, I think that being a patient really, allows me to appreciate patienthood a little bit more. And
Mhm.
I know that, everyone is a patient in a different way, to a different
Of course.
degree. And everyone sort of sees themselves as someone who has or does not have the level of health that they want to have. Um, and I'm not even talking about sort of medical conditions. I'm talking about, one's own wellness, one's mental health, behavioral health, in addition to physical health. But I think that, being someone who very quickly transitioned as someone who pursued health as a form of, wellness and activity, physical activity, and function, to someone who had to think about sort of my body's dysfunction and think about it every day and come up with strategies to address that in order to regain function and sort of restore myself. That certainly, that perspective, I think, gave me a deeper understanding of what most of my patients go through when they're acutely ill and then have to restore themselves, rehabilitate themselves, return to their functional baseline, and then try to move past their baseline before their injury or acute illness.
Hmm. Right.
Um, and I think also, certainly, this process gave me a lot of perspective on what it's like to live with a chronic medical condition,
Mhm.
which I think is very different from, having a condition where you go into a hospital or a facility, or, you get something fixed, and then you go back out and go on with your life. I think,
Right.
um, you know, spinal cord injury is obviously something that I deal with from every day in a different way, and thinking about that process and the way it's changed over time, um, with different levels of sort of acuity of that illness in between,
Hmm.
gives me a greater appreciation for what it's like to have any chronic medical condition, not just those that have sort of been termed disabilities.
Right. And so you're an internist or general, medicine doctor. What types of I mean, you see patients of all different sorts. I mean, that's a given. But I mean, what are some of the, I guess, most common? I don't know if this is the best way to put it, but like the most common um, conditions that you see, like of your patients, like on a regular basis. Now, I don't know. Just does somebody come to you because they feel a particular bond because they know that you have an injury yourself,
Mm.
or um you know but they call up, and I mean, obviously they call up to nth degree, and your secretary, and say, oh, I need to make an appointment. Okay, Dr. Snyder, blah blah blah. But do you feel like there's a connection that patients relate to wanting to come to you versus another internist?
Yeah, that's a really good question, Alexandra, and I'll say that um, I don't feel that, but mostly perhaps because of the type of medicine that I practice.
Okay.
So I don't have a front desk where patients can call to make appointments. I'm seeing patients in the emergency room, and
Okay.
they're getting taken up into the hospital because of how sick they are. In the
Okay.
past, I did practice primary care, um,
Okay.
and um, and that was early in my career, and now that I practice hospital medicine, patients aren't really, unfortunately, well, for better or for worse, they're not really electing to see me. They have to come into the
Right.
hospital because of how sick they are. And I think, to answer your question, though, I know what you're sort of asking toward, and I think that those patients that I have seen in the hospital that have mobility impairment
Right.
and that have spinal cord injury, certainly, I I feel like I am able to empathize with them in a way that I think would have been difficult for me to do prior to my
Hmm.
injury. Um, I won't speak for other doctors, because I think doctors have to flex the muscle of empathy all the time, and I will say that for myself, before and after my injury, I'm certainly more able to speak to and interact with, and communicate with patients with mobility impairment and spinal cord injury in a way I would not have been able to before, um, and create deeper relationships. I hope for it.
Right. No, absolutely. And do you think that, I mean, clearly, as anyone, including myself, that has an injury, there's more empathy, there's more compassion. Do you think that, uh, generally, like, relates to people who've basically been in a patient's shoes, quote unquote, who's coming to see you, or do you think all medical doctors have the same, like, caring and empathy, injury or not?
That's a great question. I think that all doctors, I hope that all doctors have that level of empathy in different ways. And I think that, you know, just, like I said, I think that having had this experience
Hmm.
allows me to share that experience with others who have a
Hmm.
similar experience.
Hmm.
I think that it also allows me to imagine and sort of engage in the thought experiment of what it would be like, the sort of emotion experiment, if you will, of what it would be like to have um, bias be directed against me, um, of being in a minority, of having a chronic medical condition, um, and of dealing with acute illness, as well as the mobility issues that I mentioned. And I think that all doctors have many of those experiences to one degree or another.
Before they
Um,
go into medicine.
yeah, I do think it's a matter of degree. And I think that, just because I had the experience that I have does not make me more empathic. I think that it is a consistent exercise, in my view, empathy, that I think doctors are both more, they are more willing to engage in that exercise on the whole. But I think that as a rule in society, it is a good thing to engage in that exercise. I think that we're lacking in that in many ways right now, and I'm encouraged to see others engage in that exercise when they do. We have to in medicine a lot to get to the root cause of the problems that we see, and I think that's true. However, outside of medicine as well.
Yeah, I would agree. And so I guess maybe just give us a story, quote unquote, obviously using alias names and all of that, but of work that you've done with a patient, where you've seen your work really be impacted by that patient and has helped them helped that person gotten from A to B, whether it be with their mobility issues, and so forth.
Yes, no, I think that to answer your question about a particular patient's story, I want to sort of draw your attention not to what it would have been like for me to sort of interact with someone else who was in a wheelchair in a clinic setting, but what it has been like for me to come into a patient's room and see their wheelchair at bedside when they're lying in bed acutely ill, and recently in some situations lying in an intensive care unit, acutely ill. I think the way that I'm able to speak to that patient addresses the transitions of care that they will experience and the way in which their acute illness really will impact them if they already have a mobility impairment, and the things that they may have to think about in terms of restoration and rehabilitation that others do not, to get back to baseline. Also, and to some extent, the types of complications that they'll be at risk for that perhaps others won't be at risk for, due to either their bowel or bladder function or the risk of secondary complications like clots. I think that generally when people have chronic medical conditions and have a really acute worsening of those conditions, the sort of burden of chronic medical condition makes it harder to get back to baseline. And so coaching people through that process of what that looked like for me and has looked like for me when I've had those issues has been helpful. I think it's been powerful for some patients. However, I think that patients who already have a chronic medical condition already have their own patient wisdom around those things that they need to do to get back to their baseline.
Yeah. No, absolutely. And it's just very interesting. I mean, if I was like, if I was in a patient's shoes and to, see you like, quote unquote walk in, obviously come in with your wheelchair and so forth, from my end, I mean, the way that I would view you would be so much different and obviously a positive light. I mean, than, if it was, a traditional, person who didn't have some type of injury. And I think the impact would be far greater than a traditional doctor. Like in some ways I wish that like you could be my doctor. Like
I appreciate you saying that. I mean, I think I've certainly had patients say to me that they appreciate what I am doing for them just by virtue of bringing to my experience to our interaction. And perhaps that's a lesson that I've learned that any doctor can act upon. We spend so much time trying to understand the experience of our patients, and oftentimes I think patients also want to understand ours in order to form that relationship with us that allows us then to feel comfortable sharing the experience that is empathy, that is the foundation of empathy. And I think that motivates behavior change, right? I think that there's a difference between me telling a patient to do something and then following up with them in 6 months to see whether or not they've done that thing. There's a difference between that and speaking with a patient about the difficulty that I've had in achieving a health outcome and the ways I've to various degrees been successful or unsuccessful in that process, and then how I suggest they can approach their own problems to achieve the health outcomes that they want to achieve.
Yeah, no, I totally agree. And I also think, being a patient tends to, being a patient, talking to, being seen by a doctor who does not have an injury or a disability of some sort. I think there's always questions that quote unquote arise because as much as a doctor, doesn't have some type of injury, knows from the medical and, from seeing patients about their deficits and, what they're going through, and they can share X, Y, and Z levels of compassion and empathy. They don't understand or they don't know what living in an injured body is like, and so that's a plus for you because you do.
Yeah, I think that in some ways, this is maybe not a popular sort of perspective on this, but in some ways it's easier for me to have that initial empathetic interaction or empathic interaction with a patient because they see that I have a chronic medical condition and a quote unquote disability. And many doctors and patients have a different ability. If we're defining this in terms of ability, and we're saying that disability is sort of one's ability or inability to interact with their environment or do the things that other people can do, that's a matter of degree. And I think it's affected by any medical condition that one has. Sometimes that's obvious. Sometimes that's visible. Other times it's less visible. And so I speak from the perspective of mobility impairment as someone who sits in a manual wheelchair that anybody can see when I roll into the room. And in the type of medicine that I practice, I think that's a really, really powerful way to initially engage with the patient who is willing to engage in a deeper conversation about health. I think that, however, any doctor can use their experience as a patient to interact with patients in a more effective way.
Yeah, I was just saying, I'm using, you as somebody who has a disability or an injury, however you want to call it, using that as more of a, a lens of, empathy that's different than, a traditional doctor without a disability or injury, and their level of empathy. And, there could be like slight differences, obviously, as we've just been discussing. But, there is no right or wrong, because doctors, they're everyone's, they're a patient's biggest supporters.
I will say that one way in which the process of becoming a patient has really changed my perspective in a way that I think allows me to speak to patients in a way that is different from many other doctors is around the non-clinical drivers of healthcare and of the ways in which patients sort of experience the healthcare system. I think that in medicine, we are trained in medicine and we are trained in the delivery of medicine, and we live in, primarily these hospitals and clinics where that is our currency. And I think that, understanding that my path through health and healthcare primarily occurs outside of those settings and primarily has nothing to do with my doctors or my nurses or anyone with a medical license of any sort, gives me a different perspective on how I can then try to amplify or magnify a patient's ability to pursue their own health and wellness outside of my clinic or my hospital. And I think that has to do, it has a lot to do with a patient's ability to pay for their own health care, their insurance, their their social drivers of health, the level of support they have, their built environment, whether or not they have access to healthy food and a safe home. Those are the things that I think more about now than I did before, because they drive so much of healthcare, and they frankly determine in many ways the success of our interventions in healthcare that happen at these points in time. And as patients sort of transition through those points in time, I think we as providers of healthcare need to think about how to wrap our arms around those patients a little bit more to help them with those sorts of problems.
And so when it gets to, I guess we're going to get now into more of the clinical side of being a doctor, but so somebody who has a difference, and clearly there are other doctors that do have differences, X, Y, and Z, out there. You guys are definitely a special group, not too many, depending upon the injury level. But are there different types of adaptive equipment that you or other professionals who have some type of difference use when practicing?
Yes, I'll speak for myself, and then I'll try to speak for others. I'll say that I only use a manual wheelchair, and that is the piece of adaptive equipment that I use and need. I think that being in a hospital setting is, being in a wheelchair is actually a great strength. I think people oftentimes they smile when I tell them that I get around more easily than anyone in the hospital, because it's a built environment that is conducive to mobility and is adapted. That's not true of every environment, of course. And I thought when I was in training and broke my back and experienced my injury that I would need more types of adaptive equipment than I do. I thought that I would need a stand-up wheelchair. I thought that I would need a power wheelchair. I thought that I would need, different pieces of adaptive equipment to be able to reach patients in different ways. I feel fortunate in that my injury has left me with the ability to do the things that I need to do for the type of medicine that I practice. Mm-hmm. That is different, of course, for someone who is a surgeon, or who does more procedures. The procedures that I do, I'm able to do from the position that I'm in.
What are some of these procedures that you do?
The procedures that we do in hospital medicine are thoracentesis, paracentesis, insertion of intravenous catheters of different sorts, such as central venous catheters and arterial lines. I don't do them now as much as I used to. When I needed to, I was able to, and I really enjoy doing those.
For sure.
In fact, I almost went into emergency medicine before internal medicine because of how much I enjoy those sorts of things. Mm-hmm. And so in speaking for other doctors with mobility impairments or disabilities generally, I think it's really important to sort of define the type of disability, quote unquote, that we're talking about, because an intellectual disability, an attention disability, a psychological disability, versus a chronic health disability or a mobility impairment, all very different, I think, and require different types of intervention or assistance. I think generally, though, disability is not well represented in medicine and medical delivery. That I feel like that's changing. I feel like that's changing because of more trainees who have approached me and others for sort of guidance in this field, and I'm encouraged by that. I think that I'm very fortunate because of many other leaders of medicine and healthcare that have come before me and blazed that path to a degree.
Yeah. And it's, and it's great that we also live in a world where we can have X, Y, and Z, adaptive equipment and, different accommodations and so forth.
Right.
Because, X number of years ago, I don't think, well, okay, I'm 31. So, 31 years ago, there was definitely, the access of care, as well as, what, and well as accommodations and so forth. I mean, it was totally different. And it continues to change on a basically a yearly basis, it seems like.
Yeah, it's amazing to me that we live in a year 30 years after the ADA passage, and
Yeah.
you and I both sort of were new to the world at the
Yeah.
time when folks that live that live and have lived before us have really fought for this type of equity, and I think that fight has translated into a perspective that you and I have that is entirely different um, than others, and we're very, very fortunate for that. I do think that recently in the COVID-19 pandemic and the way in which we've thought through how society protects its own, I have been able to appreciate to a greater degree, I think, what it might have been like in advocating for the ADA and the things that have gone into it,
Mm-hmm.
um, because I think that um, there there has been sort of, in my view, there's been a renaissance of advocacy for how to think about disability in healthcare, when everyone has become a patient and everyone is thinking about public health and everyone is thinking about their proclivity to become a patient very quickly and in an unexpected way.
Right. No, absolutely. And so I guess actually just going back 30x years ago, and we were like on our we were like basically our tots, how did your parents I guess, well, you were in medical school, so I guess it's a little bit different, but still, it doesn't matter. So when you sustained your injury, how did your parents, quote unquote, react, or kind of what was their perspective on what your life was going to be like? Just knowing what was, out there, in
Yeah,
terms of disabilities and, achievements and success and
yeah. That's a really good question, Alexandra. I'm not sure. I know that my family, my loved ones, had a lot of concern
okay.
around what my life would be like, the sort of disadvantages that I may have in going through my training. And I think that they probably thought about those things earlier than I did because I wasn't in a position to consider those things when my injury first occurred. I, I can't speak to the way in which they sort of had used their historical perspective
Hmm.
and overlaid it onto my situation. But I will say that the support that they gave me was outsized. I was, fortunate in some ways, in every way to be. My injury occurred in the city where my family lives, and
Philadelphia.
yeah, so my family is from media,
Okay.
and so we're very close to Lansdale and Westchester and other places in the suburbs of Philly. And I felt when I was injured and I broke my back in the suburbs of Philadelphia, and I think that my point there is that they probably their response and their support of me during my injury process was probably proportional to their concern that they had around the disadvantages that I may have, both in terms of my health and also in terms of my future career and personal life. And so I can't speak directly to,
Of course, right.
yeah, but I think that I am the great beneficiary of their support and continue to be to this day.
Yeah, and and I'm sure yeah, every day is, a new gift to see you in terms of what you're achieving and doing personally, professionally, and so forth. Now, when you had your injury, were you like, even though obviously we're a third year in medical school, but was there a time where you had to come home, and couldn't, and basically live at home with your parents, or whether it would be a sibling or so forth, before you went on to then be able to be independent? And like, I mean, clearly there were doubts, but What was that like?
Yeah, so I'll tell you, the process was that I was injured on the 17th of June 2013. I was in the hospital for a few weeks thereafter with some surgeries and acute inpatient care. Then I was at a rehabilitation hospital for several weeks thereafter, months. And then I came home to my parents' home in the suburbs of Philadelphia, from where I lived for really the better part of a year while doing outpatient rehabilitation and physical therapy. Then I largely moved out of their house and lived in the city of Philadelphia and continued with the fourth year of my medical training. I did some parts of that during that year of rehabilitation. Um, but obviously feel very fortunate to have had that ability to have their support during the time.
Yeah, no, absolutely. And now you're in Boston, which is wonderful.
Yes, no. So my wife and I came up to Boston to do our medical training. My wife's a surgeon.
Okay.
And she's at Mass General Hospital. I did my medical training at the Brigham and Women's Hospital, and we're both now here for training and for work and for the foreseeable future. We have two young kids, a 3-year-old daughter and an 18-month-old son, and they're growing up in Boston and loving it.
That's awesome. I was going to ask about you. That's amazing. Now, is your wife also from the Philadelphia area?
She is from the Northern Virginia area.
Okay.
Right, okay. And so we met in medical school, and we went to the same undergrad together, but we met in medical school.
Now, did you meet medical school prior to your injury?
Yes. Yeah, we had dated for the majority of medical school prior to my injury.
Oh, wow.
Really 3 years prior to my injury.
That's an amazing story, though. And now you have 2 kids, and wow, that's incredible, though. So yeah, your wife has seen the entire process.
Yeah, she's my partner, and she's been my sort of rock throughout all.
Yeah, of course, and she plays a big role, in your life on a day-to-day basis too. If you need assistance for X, Y, and Z. I mean, clearly, if from the waist down and so forth and.
Yeah, it's funny. I don't think that she helps me in the way that some people sort of assume. That I think the way that she helps me is far different from the way in which people sort of assume that she would help me. And that let me be explicit. She performs nothing medical for me, whatsoever.
No, and I didn't think that at all.
No, and I think what I hope to underscore is that her partnership is emotional, and our relationship is a large part of what has given me the confidence and ambition to do what I do. Right. And I think that one of the biggest social drivers of health and wellness is loneliness, and I say that because at various points in time in my life, I think I felt that. Everyone has felt that to a degree or another. And I think a lot of people feel it right now more than ever. Mm-hmm. In a world where we're distancing physically and socially and emotionally in many ways. And I feel very fortunate that her partnership has been one of emotional support as we've built our family together.
Yeah, it makes me want to tear up. It sounds like an amazing story. And so I guess just talking a little bit about the fact that you have 2 kids, how have they, I mean, I know one's 18 months, so he's a year and a half. And how old's your daughter?
She's 3.
She's 3. Okay, so they're still young, but how have you seen them grow up and their perception of, you as somebody who's in a wheelchair, unlike mom or other people, have you seen, obviously what doesn't matter to them because they're your dad. You're their dad, but I'm just saying, have you seen any subtle curiosity or
that's a great question. I think I've had that question a lot less than you probably would think. I think perhaps because when I moved from Philadelphia to Boston, a lot of things changed for me. And I think the primary one was that I knew very few people in Boston and in my life in healthcare that had known me when I was ambulatory. And so they sort of probably identified me as someone who sits in a wheelchair from day one, whereas I thought of myself as ambulatory in many ways because that's what I had known for the majority of my life. And the same applies to my children. I think they're obviously to be determined in terms of how they'll view me sitting in a wheelchair going forward, but especially for my 3-year-old daughter, I think the power of it is that she sees diversity in her day-to-day life.
I think that's good. There's not a lot of people that do.
Yeah, I mean, I think that there's a demystification, hopefully, in our personal lives for her around what it must be like for someone to be in a wheelchair. And my son, who's 18 months, he just likes going for rides in the wheelchair. And so I think that
you're gonna have to buy him like a wheelchair just so he can have one to ride around on his own.
Right now, I do wonder. No, to be honest with you, I wonder how their perception of that will change over time. What I hope is that they will have a greater appreciation for medical conditions generally, but also specifically for mobility impairment, and that it won't be something that's alien to them as they grow up.
What we know now, we didn't know 30 years ago, and disabilities were not accepted the way they are now, and and to see somebody who's not like you is like be offensive, or I'm just using these terms as just generally speaking, but I think my whole point is that your kids are going to grow up in a much healthier environment, and they will so. It's just a part of life, but it doesn't define a person.
Yeah, I hope so. I think that I'll take what you just said and I'll try to extend it or extrapolate it a little bit, because I think for when you said that they'll look at disability in a certain way, my hope is that we can take the word disability and sort of insert diversity as well.
Of course.
Make it a little bit more broad, and it's not, in my view, it's not about whether or not the person that's in front of them can or cannot walk. It's more about whether or not the person in front of them, the recognition that that person is different from them, no matter whether or not they look the same or walk the same or think the same or share the same religion or culture. And I think that the recognition of everyone's difference and then the appreciation of everyone's difference is what I hope that they internalize over time. And I think that's what I feel that we all need now more than ever.
I totally agree. Yeah, I mean, I just use my words just out and open, but no, I mean, I think I don't use the word disability in terms of my work. I mean, obviously I'm using it in terms of our context of a conversation, but it'd be nice if if that word was not in existence, and you looked at the other perspectives of someone who's quote unquote different.
Yeah, it's interesting. In seeing your videos and the website and such, I am fascinated by how much we, and I just want to talk about this for a minute, how much we have used the word disability, because I think that, you and I probably feel the same way, that I don't think of myself as disabled. And I'm sure that we are thought of as disabled by other people. Mm-hmm. And, I'm sure that, people see my handicap placard and what they see is handicap. And I don't think of myself in that way really at all. And I also, I think that different and able is really powerful. I think that everyone is different and able in different ways, and I think that exploring the ways in which they are able relative to others and then learning from that is really helpful.
I would totally agree. And so I guess just in wrapping this up, Do you have like any words of advice or wisdom for anyone that's interested in going into the medical health field that has an injury? I wish I knew you. Well, you and I mean, you already had your injury by the time that I already knew what I was doing. But I originally wanted to go to medical school, but I knew that I couldn't do it from a cognitive standpoint. So I envy you in so many good ways. But do you have any advice for those that want to go to medical school or become a doctor and have a difference and having doubts and what would you
Yeah.
tell?
Yeah, the first thing that I would say is to, first thing I would ask is really what is driving your desire to be a doctor, because I think that there are ways of practicing healthcare that do not involve, being a doctor or a nurse or another type of healthcare provider. I think that, some of the most caring people that I have encountered and interacted with in healthcare are not doctors or nurses or physician's assistants or practitioners of any sort. So I think that one, challenging oneself and asking that is the first step. And if one sort of decides that the practice of medicine is sort of the synthesis of science and the humanities in face-to-face care of someone, is what they want to do, then I would stop at nothing. I would find ways to adapt one's needs to the process. I hope the process is becoming more open to those needs in a way that it wasn't before, because I do think there's a general recognition that people who have different abilities, and the diversity that you and I have talked about are important in medicine as they are everywhere to reflect the population of patients that we treat. And now more than ever, I think the ways in which our experience allows us to understand some of the social and non-clinical drivers of health is more appreciated than it's been in the past. And so for those folks who are interested in medicine specifically, but healthcare generally, I would empower yourself in that direction by really understanding those social and non-clinical drivers of medicine and health as you explore the medical science and the sort of humanities of medicine, because I think that's where you are differentially able to add value in medicine.
Those are great words of wisdom. Well, this was lovely.